You know, when most people think of the doctor, things like appointments, clinic visits, medications, those are the things that tend to come to mind. But for me as a doctor, music is a big part of the care that I offer. I'm Dr. Sydelle Ross, a hospice and palliative medicine physician, and today I'd like to share with you how the music and medicine came together for me. Growing up in the Twin Island Republic of Trinidad and Tobago in the Caribbean, music was all around me. And from a very young age, I knew that I wanted to become a doctor. I loved my pediatrician. And I also loved singing. And so I had this idea of combining the two to become a singing doctor. As a hospice and palliative medicine physician, I take care of seriously ill patients and their loved ones. And the first time I sang for a patient at the bedside, it just so happened that he was a professional jazz musician, a saxophonist. And I shared a lot of songs with him, songs that were meaningful to him, that he could connect with. Having been a jazz musician for many years, playing with iconic jazz musicians such as Dizzy Gillespie. And one of the things he revealed to me before he died was that he wanted a bedside jam session. I met him during his final days of life. And so I got together with some friends, two saxophonists, a trumpeter, and I was the vocalist, and we granted his wish. Before we arrived, he just was lying there, seemingly lifeless in the bed. But once my friend started playing and I started singing, you could see him come to life again. And it was as if he was reconnecting with himself through the music. The music was reawakening a sense of purpose and giving him life. You know, we sang some of his favorites. Summertime and the living is easy. Fish are jumping and the cotton is high. Oh, your daddy's rich and your ma, she's good looking. So hush, little baby, don't you cry. One of these mornings, you're gonna rise up singing. Then you'll spread your wings and take to the sky. But until that morning, no, there's nothing can harm you. With Mama and Daddy standing by. And there was another song that he enjoyed that we shared. When lonely feelings chill the meadows of your mind, just think, when winter comes, can spring be far behind? Beneath the deepest snows, the secret of a rose is simply that it knows you must believe in spring. And as my friends continued to play and I continued to sing, I could see the tears welling up in his eyes and streaming down his cheeks. And to this day, it's one of the most touching things that I have witnessed. I saw how music touched him in a way that very few things could at that time of his life. And I also noticed the impact of the music on his loved ones. His daughter happened to be at the bedside, and she too began to cry. I also noticed the way the music touched the healthcare workers who were present, the nurses, the nursing assistants. And you can see them kind of breathing a sigh of relief, kind of taking comfort in the music. You know, the healthcare environment is tough. We're often faced with very difficult situations and we're just expected to keep going. The music clearly gave us all a chance to pause and reflect, connect with ourselves and connect with everyone else who was there. It was something that was much needed. It was truly a gift. And you know, prior to that experience, I had often wondered if music could offer something of value in spaces of healing. Deep in my heart, I felt that it could, but I hesitated to offer it for a long time because I wasn't sure if it would be accepted, if it would be appreciated. And to be honest, I think to some extent I was ashamed to offer it because I wasn't sure what people would think of me. Who is this doctor singing and offering music? That just doesn't happen. You don't go to medical school to do those things. And so I hid for a long time. But after that experience, I was convinced. I was convinced that there are so many valuable gifts that music can offer that medicine can't. And so I was inspired to keep going. And so now I call myself the singing doctor, as my 6-year-old self knew I was meant to become. And now if a patient or a loved one tells me that music has been a big part of their life, then I take the opportunity to share the gift of music with them, to offer what's called patient-centered care. So care that takes into account what is important to a patient. And I can tell you that through the music, it really strengthens the connection that I have with patients and their loved ones. It has humanized the healthcare experience for many of my patients. And it is such a gift, not just to the patients, their loved ones, the staff, but also to myself. So if you are a patient, a loved one, a caregiver, a healthcare worker, or simply someone who believes in the power of music, I invite you to join me on this journey.